We've come to the end of this module. Welcome to this module on administering CHAS at your clinic. In this module, you will gain an understanding in the following areas. We hope that at the end of the module, you will be familiar with what CHAS is, CHAS subsidy tiers, administering CHAS, CHAS claim submission, CHAS referral to specialist outpatient clinics, and lastly, CHAS audit. There will be a quiz after this module to test your understanding of these topics. First, we will go through the basics of CHAS, including what CHAS is and how CHAS should be used. CHAS is a means-tested subsidy scheme to ensure affordable primary care for Singaporeans. CHAS provides Singaporeans access to subsidies for medical and dental care treatment at participating private GP clinics and dental clinics near their homes. CHAS is a co-payment scheme. During the patient's visit, a CHAS subsidy amount should be deducted from the patient's total bill and the remaining amount to be paid by the patient. The CHAS clinic would subsequently claim back this CHAS subsidy amount. As a practitioner, you are responsible for knowing the conditions that are covered by CHAS subsidies, and you should advise your patients before the treatment on the charges, whether the treatment can be claimed under CHAS, and the CHAS subsidy that can be claimed. CHAS covers acute conditions such as abdominal pain, cough, cold, fever, and headache. CHAS also covers these chronic diseases under the Chronic Disease Management Program. When a household is deemed eligible for CHAS, each family member will have his or her own CHAS card. Each member of the household should use their own CHAS card during their visit to the CHAS clinic. Using someone else's CHAS card is not allowed. During the CHAS patient's visit, CHAS clinics should check in the claim system to verify the patient's CHAS status and accord the relevant subsidy based on the patient's card type indicated in the claim system. If possible, clinic staff should always check the patient's CHAS card against the patient's identity documentation. It is very important to take note of the expiry date of the CHAS card too. CHAS subsidies cannot be claimed for the patient once their CHAS status expires. CHAS clinics are encouraged to place a notice like this on their registration counters so that their patients who hold any of these cards can readily show these cards at point of registration. Households can apply for CHAS by filling up the application forms available at most CHAS clinics, community centres or clubs, community development councils, public hospitals, and polyclinics. Alternatively, the forms can be downloaded from the CHAS website. CHAS cards have a validity period of 2 years. The renewal process is automatically initiated for households 3 months before validity expiry, as long as they continue to meet the eligibility criteria. For households that do not undergo automatic renewal, they will receive a letter inviting them to submit a renewal form. Now, we will be learning more about the subsidy amounts and claim caps for the 3 CHAS subsidy tiers. CHAS has subsidy tiers for 3 groups of patients: those with CHAS Blue, CHAS Orange, and Pioneer Generation status. This is a table showing the different subsidy amounts that the 3 groups of patients are eligible for. For patients with a CHAS Blue card, they are eligible for up to $18.50 in CHAS subsidies for a visit for acute conditions. For chronic conditions, there are 2 tiers of claims: Chronic Simple and Chronic Complex. Chronic Simple claims can be made for patients with a single chronic condition. CHAS Blue card holders eligible for the Chronic Simple claim tier can be subsidized up to $80 per visit, capped at $320 per year. Complex refers to chronic complex claims, and chronic complex claims can be made for patients with multiple chronic conditions or patients with a single chronic condition but with complications. CHAS Blue cardholders eligible for the Chronic Complex Claim tier can be subsidized up to $120 per visit, capped at $480 per year. For patients with a CHAS Orange card, there are no CHAS subsidies for visits for acute conditions. CHAS Orange patients under the Chronic Simple tier can be subsidized up to $50 per visit, capped at $200 per year, while those under the Chronic Complex tier can be subsidized up to $75 per visit, capped at $300 per year. For patients with the Pioneer Generation card, they are eligible for up to $28.50 in CHAS subsidies for a visit for acute conditions. For Pioneer Generation patients under the Chronic Simple tier, they can be subsidized up to $90 per visit, capped at $360 per year, while those under the Chronic Complex tier can be subsidized up to $135 per visit, capped at $540 per year. Singaporeans' PA cardholders enjoy CHAS subsidies at CHAS clinics. For patients holding the PA card, their full bill for the visit would be subsidized under CHAS, and no out-of-pocket payment is required of them. Monthly and per-visit caps on claims will be the same as CHAS Blue cardholders. There are monthly and annual caps on CHAS claims applicable to all subsidy tiers: CHAS Blue, CHAS Orange, and Pioneer Generation cardholders. For acute claims, each patient is eligible for 4 claims per clinic per month. For chronic claims, there is a monthly cap of 4 claims per patient per clinic, subject to the patient's remaining chronic balance. There is also an annual subsidy balance for claims under chronic conditions. This balance is renewed every calendar year and is shared by all CHAS clinics. Clinics should manage their chronic patients' conditions and their subsidy balance throughout the year. It is important to always check the patient's remaining chronic balance at the start of the patient's visit, so as to better advise patients on the amount of chronic subsidy that the patient can claim for that visit. Also, each patient is limited to either 1 acute or 1 chronic claim per day per clinic. For example, if a patient visits for fever, which is an acute condition, and requires diabetes medication for managing the chronic condition, the clinic can only make either an acute claim or chronic claim. Under the chronic claim, the clinic is allowed to have an acute component, but the claim amount for the acute component cannot be more than the typical acute subsidy amount. For visits where a patient is seen for both an acute condition and a chronic condition, and for example the chronic claim is $50, within this chronic claim there can be acute components, but the value of the acute component must not be more than $18.50 for CHAS Blue patients and $28.50 for Pioneer patients, since this is the typical amount of subsidy for an acute visit. In the event that a patient possesses 2 CHAS cards, only one card is applicable, which is the one with a higher cap amount. Please check on your patient's CHAS status before the treatment and before giving subsidy to the patient. For instance, if the patient is holding on to both a PG card and a CHAS Blue card, the card with a higher subsidy is applicable, and in this case, the patient would get subsidies related to the PG card. Pioneers with a CHAS card can enjoy higher subsidies with their CHAS status at specialist outpatient clinics. Next, let us go through the steps necessary to administer CHAS at clinics effectively. Clinic staff should always check the patient's CHAS card against the identity card or other forms of identification documents because only Singaporeans are eligible for CHAS. An adult patient will need to present his or her NRIC along with a CHAS card or PG card. Other forms of photo identification, such as birth certificate and driving license, are also acceptable. Cardholders below 15 years old are to present their birth certificates or student identification together with a CHAS card for verification. If a patient forgets to bring his or her CHAS card, you may check the MOH Healthcare Claims portal to verify their CHAS status. During the consultation, the attending doctor should provide information regarding the patient's conditions and the relevant CHAS subsidies that are applicable to them prior to any treatment. All doctors should be familiar with the CHAS claim guidelines on what can or cannot be claimed before attending to CHAS patients. As the practitioner, you should provide care for patients in line with the latest clinical practice guidelines, CDMP handbook, and/or the best available evidence-based practice. You should not provide services that the CHAS patient does not require. As the attending doctor, you are responsible for what you indicate in your clinical notes, as this information will be indicated in the claim submitted. All clinical notes may be selected for review during the audit of the corresponding claim. As the attending doctor, you're responsible for what you indicate in your clinical notes, as this information will be indicated in the claim submitted. Please click on each of the bullet points to find out more about the type of documentation required for the justification of the CHAS claim. It is mandatory for all CHAS clinics to issue itemized receipts to all CHAS patients, including Pioneer Generation and public assistance patients. This includes patients whose bills are covered fully by CHAS subsidies and are not required to make any out-of-pocket payment. Issuing itemized receipts help to improve the transparency of charges and subsidy provided for your patients. Here is an example of an itemized receipt. The total charges are broken down into the consultation, medication, investigation, and other categories. The total CHAS subsidy given and remaining amount payable by the patient should also be shown in the itemized receipt. Do note that if your clinic is already providing a more detailed itemized receipt, you should keep to your existing receipt format. Let us find out more about CHAS. Upon successful accreditation onto CDMP and CHAS, you will receive a welcome pack with the following resources. Should there be any updates to these resources, the Agency for Integrated Care, otherwise known as AIC, will provide them to you. If you need any top-up of these resources, you may request them from AIC. CHAS clinics should only make use of the provided CHAS collaterals to advertise clinics' participation on scheme. Do note that any production of collaterals containing a CHAS logo for clinics' customized publicity is subject to approval from MOH. After your clinic is CHAS accredited, the AIC would be your go-to resource for all queries regarding CHAS. You should speak to your AIC account manager if in any doubt on CHAS administration. You should also be able to find available resources on the CHAS website, Primary Care Pages website, or Resource Hub in the MOH Healthcare Claims Portal. Here are other useful resources that you can refer to. In this segment, we will learn more about the process of submitting CHAS claims. CHAS claim submission can be done easily via the MOH Healthcare Claims Portal, otherwise known as the MHCP. All claims submitted must be within 1 month from the visit date. Claims submitted later than 1 month will be deemed as a late claim and will be rejected. All clinic staff can access MHCP using their own CourtPass ID. For more information on eligibility for CourtPass, you may refer to the CourtPass website for more details. Alternatively, you may also contact them via their email or helpline. Alternatively, GPs can utilize a compatible clinic management system, CMS, which does not require 2FA to log in, for automated claim submissions to MHCP. Check in the Resource Hub button located at the side menu for all the important information on CHAS claim guidelines and other handbooks or forms you would need. To appoint a clinic manager or practitioner to be in charge of claim submissions, click the Clinic Management button located at the side menu. As a practitioner, you're responsible for reporting your patient's clinical indicators for the chronic conditions shown. These indicators are the reportable essential care components for the management of the selected chronic conditions. The main objectives for requiring you to report these care components are to facilitate 1. Good management of the patient's chronic conditions, and 2. Gap analysis to guide resourcing. Refer to the table for the full list of clinical indicators mandatory for submission or reporting. You may not be involved in the claim creation, as your clinic assistant may be tasked to do it. However, you're responsible for what you indicate in your case notes and for relevant aspects of the claim submitted in your name. Therefore, you need to be familiar with the MHCP and the claim process. You should refer to the training module in MHCP for more details on specific functions in MHCP. You should be familiar with MHCP before submitting any CHAS claims. Now we will learn more about referring your CHAS patients to specialist outpatient clinics. CHAS clinics can refer CHAS patients to specialist outpatient clinics for subsidized treatment under the subsidized status. For CHAS patients that are referred to a specialist outpatient clinic, this referral must be indicated in the CHAS claim submitted for them. Here are the conditions to be met for such referrals. Let us look into the steps involved in making a CHAS referral. First, complete the CHAS referral form by filling in the standard information required. Next, check the CHAS referral information sheet to determine the appropriate mode of referral for each SOC. Either the referring practitioner or patient can fix the appointment via a phone call, highlighting the patient's CHAS status. For faxes, the staff of the SOCs will contact the referring clinic or patient to confirm the appointment after their assessment. Finally, remind patients to bring the required documents on the day of the appointment. The clinic staff should provide the patient with these documents. If the patient fails to present these documents, he or she may be registered as a private patient. If the patient does not have the documents on the day of the appointment, the SOC may contact the referring clinic to obtain them by fax or email. Moving on, we will examine the CHAS audit process and requirements of the audits. Audits on CHAS clinics are conducted periodically in a year by MOH-appointed auditors from MOH Holdings. This is to ensure greater accountability on the use of public funds, assess the compliance of claims with CHAS guidelines, and to check if clinics maintained accurate and complete clinical and financial records of all treated CHAS patients. Typically, a letter of notification will be sent by the auditors to inform the clinic about an upcoming audit. The clinic will have 2 weeks to collate and submit the necessary documents to the auditors. After the audit is completed, there will be a letter of audit findings issued to the clinic stating the non-compliances found, as well as any follow-up actions to happen. The CHAS audit covers mainly 2 aspects, clinical and financial. The clinical audit checks on whether the diagnosis indicated in the claim is as what was indicated in the clinical notes. If the claim is a chronic claim, there will be checks on whether there is sufficient justification for the claim to be made in this particular chronic tier. There will also be checks on whether relevant clinical information for the patient was recorded in the clinical notes, and also whether the treatment and investigation prescribed were relevant for the patient. The financial aspect of the audit checks on whether the subsidy claimed matches the subsidy that was extended to the patient. These checks are done by verifying if the financial data submitted in the claim is accurate and tallies with the charges and subsidy recorded in the case notes and itemized bill issued to the patient. Checks will also be done on whether the subsidy was used in accordance with the terms of the CHAS guidelines and whether an itemized receipt was issued to the patients. Here is a list of possible documents that clinics are required to submit for a CHAS audit. The auditor can request from the clinic any additional documentation beyond what is usually expected as part of the audit, as long as advance notice is given. For a claim to be deemed as made in accordance with the CHAS guidelines, the details of the claim have to be supported by both clinical and financial records. If either the clinical or financial record is incomplete or inaccurate, the subsidy for the claim would be recovered and the claim will be deemed as non-compliant to the guidelines. Here are some common errors that you should be familiar with and be careful to avoid when submitting CHAS claims. Click on each section to find out more. Majority of CHAS clinics comply with the CHAS guidelines. However, when there are cases of significant non-compliance, MOH will not hesitate to take the necessary follow-up action. MOH takes a serious view of errant practices that misuse government subsidies. Any non-compliant claims discovered during audit will be recovered by your clinic's administrator, either National Health Group Polyclinics or SingHealth Polyclinics. Clinics will be notified of the recovery of non-compliant claims. This financial loss can be avoided by submitting compliant claims. As a practitioner, you're responsible for the relevant aspects of the claim submitted in your name. When a claim is recovered, the clinic should not recover the recovered subsidy amount from the CHAS patient. Besides the recovery of claims, as MOH takes non-compliant claims very seriously, if there are any errors found during the audit of your CHAS claims, there will be follow-up actions taken against you or your clinic, depending on the severity and frequency of non-compliant claims made. You will be made to undergo an online training and test that must be passed within a stipulated deadline. You could be called to attend a mandatory training session with AIC Account Manager, undergo a mandatory self-review of past claims. Your claims could be withheld for payment until all relevant follow-up actions are completed, and also you could be suspended or terminated from CHAS. Serious errors may also be reported to the Singapore Medical Council and or the police. Let us take a look at a case study where an audit of a CHAS clinic was conducted and erroneous claims were found. MOH takes all erroneous claims seriously and will not hesitate to take follow-up actions for erroneous claims found. The CHAS audit team, through data analysis, found that a clinic was making multiple claims for a visit. Only one claim should be made for each visit. MOH views such non-compliant claims as a serious misuse of government subsidies and an unsubstantiated drawdown of patients' annual CHAS subsidy limits. Following the detection, the CHAS audit team carried out numerous site visits on the clinic to determine the validity of the CHAS claims made. The team interviewed both the clinic doctor and clinic staff to find out more about their claim process. Hundreds of claims were audited, and about 75% of them were made without corresponding case note entries and or itemized receipts. In addition, another 40,000 claims were identified as potentially non-compliant. These were considered extrapolated non-compliant claims. Following the audit, the clinic was suspended from CHAS and was asked to self-review all the extrapolated non-compliant claims. All verified non-compliant claims that did not have case notes and itemized receipts that corroborated with the claim details were recovered. Now that we've gone through the common errors and case studies of audit on erroneous clinics, here are some tips for you to avoid making such errors. For errors where there are no supporting documents to justify a condition or CHAS claim, please check and ensure that you only submit claims that have appropriate and sufficient documentation. For erroneous upcoding of chronic claims, be familiar with the criteria for when your patient is considered a chronic simple or chronic complex patient. Here are more tips on how you can avoid committing common errors found in audits. For wrong claims, such as chronic claims for acute visits, be clear on what the patient's purpose of visit is. Only submit claims for conditions seen at that visit. For erroneous claims on visits with no consultation, make it clear to your patients that generally there should be a consultation with a doctor for a CHAS claim to be made. For erroneous claims for disallowed medication and tests, you should be familiar with the items claimable under CHAS in order to avoid making such erroneous claims. Lastly, a reminder again, as MOH takes non-compliant claims very seriously, if there are any errors found during the audit of your CHAS claims, there will be follow-up actions taken against you or your clinic, depending on the severity and frequency of non-compliant claims made. Serious errors may also be reported to the Singapore Medical Council and/or the police. To avoid having to undergo these follow-up actions, you should be careful when making CHAS claims. We have come to the end of this module. Here is a summary of the learning points we have covered. Please ensure that you're familiar with these topics before you take the online test next. After your clinic is CHAS accredited, the Agency for Integrated Care, AIC, would be your go-to resource for all queries regarding CHAS. You should also be able to find help in the CHAS website or Primary Care Pages website. Here are some useful resources if you have further queries on CHAS.